So we're still with public health, PHA 567B, and this is, you can think about this lecture as maybe like a continuation of the series. So after we've spoken about the indicators and we talked about the health determinants, now we're going to talk about health promotion, and next will be disease prevention. So in this lecture, we're going to go over the definition. We're going to spend some time talking about the role of education, and then we're going to go and in more details about the health promotion interventions that could be at different levels. So first off is the definition of health promotion. Health promotions are actions affecting one or more health determinants. So you think about the health determinants that we talked about previously to enable people to maintain or improve their physical, mental, social well-being. So you remember physical, mental, social well-being. This is the definition of health coming from WHO. But what is important as well in this definition is that it has two components, maintaining and improving. So generally speaking, health promotion is somebody who is otherwise healthy, and the activity is to maintaining their health, or if they are in the situation where it's not a perfect health, they are healthy but not perfect, maybe to improve their health. And therefore, there are strategies for health promotion of three types. And you can see they're fairly simple. So number one is providing information aiming at encouraging, engaging in health behavior. So you provide information so that people will engage in a healthy behavior. Or you provide information to discourage people in engaging in health determinant behavior. So again, you're giving them information so that they do not do a bad behavior. So that's number one, providing information. Number two is modifying the environment to do what? Ya'ma, encourage person environment positive interaction, or discourage a person environment negative interaction. And obviously number three is both one and two. So بما أنه at part one we talked about providing information, which takes us to thinking about the role of education. So first definition, health education is an activity intended to change knowledge or ways of thinking that facilitate skills acquisition or behavior change related to health. So what do we mean by all of this? We're going to talk about three components of knowledge. So knowledge is essential for health promotion. For a person to engage in health promotion activity, they must have the necessary knowledge about the activity and how it affects their health. Okay, so let's talk about the three components of knowledge. The three components of knowledge are awareness, the know-how, and the underlying principles. Awareness is knowing that something is related to health, to know that smoking is bad for your health, to know that exercising is good for your health, to know that vaccination is important to prevent from catching COVID-19. Number two is the know-how. How can I quit smoking? Is to develop the skills to act on the awareness knowledge. So it's not enough to know, you have to know how. So I know exercising is good for my health. What are the types of exercise activities that I can engage in so that I improve my health? Learn the skills that I can actually exercise indoor, even if it's raining outside. I can or if I'm somebody who likes biking, to know that there are cycles, there are areas for biking where I live. So not only you know that it's good for your health, but also the skills. Uh, Knowing that vaccination is provided for free for COVID-19 and you have to register through the impact. This is the know-how. Number three is understanding the underlying principles, so the knowledge of the principle, knowledge of what constitute beneficial use as opposed to detrimental use. So not only I know that smoking is bad for my health, and the know-how, how can I quit smoking? Maybe using patches or using replacing smoking with something else. But number three is to understand why smoking is bad for my health. what is it about smoking that is bad on my health, so that I don't quit smoking cigarettes and pick up argili, for example, thinking that I am actually doing good. So to understand the underlying principle, understanding that it's the tar and it's all these chemicals that I'm inhaling that are obstructing my lungs. So even if I quit smoking cigarettes and I pick something else that still has the same bad element, well, I haven't fixed the problem. Okay, so Holy three levels are very important with knowledge, and we're going to talk about them one at a time. So, one is awareness. Individuals and communities must acquire knowledge of the things that are related to health before any action can be done to improve and maintain health. So, number one is, I think it's obvious that you should know about something before you can actually start doing it or stop doing it. So here you have an example of exercising and consuming vegetables. Before somebody starts doing that, they need to know that exercising or consuming vegetables is good for their health. Knowledge alone is not enough to ensure that person will engage in the healthy behavior. There is a need to know how to use the information so that they change their behavior or environment, and understanding of the underlying principle مثل ما قلنا, so that they don't start مثلا they think eating vegetables is good for their health, and they start thinking, well, I'm eating vegetable, it means I can also start eating um, fries, thinking that fries are vegetables. That takes us to number two, which is the know-how. It's the skill component of using the information. So you have information, but in addition to information, it's the skills. So person deciding to consume oat, they know that oat is good for their health. Now they want to consume oat. Well, they have to know where to buy it, how to store it, how to cook it. Okay. Um, the know-how could be easily neglected in health education campaigns. In the past years, I used to ask students to develop a health um, campaign, and many of them would pick up something that is about awareness campaign, awareness campaign. Awareness campaign is good, but it's not enough. It's not enough to go and tell your fellow students is it's important for you to exercise. You also need to tell them that maybe we have exercises areas at campus. You can maybe tell them the hours where these exercise operating. You can tell them maybe the trainers that are available and they can train you during these hours. Okay. The example here, a campaign aiming at increasing consumption of fruits and vegetables would typically focus on the health benefits and neglect information on how to store fresh produces and recipes of preparations. Number three is the underlying principle, the knowledge of the underlying principle. It's essential to engage in health promotion correctly. So, a person not understanding the necessity of washing fruits, vegetables before consuming, they may not wash them at all, or wash them with dirty water, or not wash adequately to remove bacteria. Um, لما بلش الكوفيد 19 في أول part is the awareness campaign, which you need to wash your hand. The next is the skills, how to wash your hand. Well, you have to wash your hand with soap. Okay. Underlying principle, you have to educate people that soap, because it contains the soap component, and because soap destroys the membrane of the virus, and therefore it's much better to wash your hand with soap than with water only. Water only is not enough. And also that you need to scrub for 20 minutes so that to allow enough time for the exposure of the soap with the virus to destroy its membrane. Okay. So I'm just so if you understand the underlying principle of soap, you would understand that, well, I should always wash my hand with soap. Soap is very important. So continuing with number three, also an important underlying factor considered in this example is the caloric intake. Education on the underlying principle is often neglected as well in health education campaigns. So many times health education campaign, they focus on awareness, they forget about the skills, the know-how, and the underlying principles, like understanding the basic concept of how it works so that you engage correctly in the health promotion activity. All right, so that was number two. We're going to move now into big number three, اللي هن the health promotion interventions. We're going to give a definition. Health promotion interventions are activities that intend to maintain or improve. Remember, this is the definition of health promotion. So, maintaining and improving the well being and are directed toward everyone in a defined target population, including healthy individuals. Obviously, health promotion, as we said, is to improve and maintain. So, even health individuals are targeted by these campaigns. Target population are typically defined by geographical like a village, or political boundaries, مثلا Syrian refugees. Health promotion intervention are based on the determinants of health at all levels. So as I told you, it's like a continuation in the lecture. We talked about the determinants of health. Now the health promotions are built on these determinants. So أول level مثل ما الhealth مثل ما determinants of health في عندنا individual, community, national, and then the global. The health promotion follow the same rationale. The first is the individual level. So these are interventions targeting individuals themselves. The goal is to persuade individuals to live in a manner that maintains or improves their health. The rationale is based on the assumption that the individual can take actions that will positively affect their health. Obviously, since you're targeting individuals, you should be targeting something that the individuals themselves can change about themselves. So, for example, the hygiene, safety, and things like that. Providing job opportunities to the community ما بيعتبر individual level. Um, it is not rare that a health promotion activity leads to multiple health outcomes. So, for example, you may be targeting people and you're maybe encouraging them to exercise. Now, the health outcome of exercising is of multiple levels: building muscles, losing weight, a better bones structure, a good posture, a reduction in the risk of developing heart disease, etc. So, meaning it targets at individual level, you're targeting individuals, as we said. مثلا, you could be targeting children at school, university students, workers in a manufactory. Okay, campaign for not drinking and driving target the general population, even though that those that don't drink are also targeted under the assumption that they can influence other. So you yourself could be someone who doesn't drink, but because you have been targeted to a campaign like that, if you're going home with your friends and your friends they drank, you can be very adamant about the fact that you're going to drive and not them. We're still at the individual level. Interventions at individual level are likely to include a large education component, and for the intervention to be most effective, then the three components that we discussed have to be part of that intervention. Okay, so remember the three components in the awareness, the know-how, and the skills, and the underlying principle. And here you have an example. A campaign intended to increase the use of helmets will need to create one, an awareness that you need to wear your helmets. You can look around, there's a lot of people on motorcycles now wearing helmets, no protection. So واحد, you create an awareness that it's important. Two, you talk to them about what is the correct way to wear your helmet. So maybe you need to fasten the small thing that goes under your chin, and you have to fasten it correctly. And the type of helmet has to be a type that protects your ear, for example. Okay. And number three, explain why helmet can protect the head. So you explain to them, well, in case of an accident, statistics that shows that 80% of the time people fall on their head, fracturing the crane, etc., etc. A helmet will protect you, and therefore you need to have a helmet that covers your ear as well. Okay, so that you're explaining the underlying principle, and also so that they understand that the helmet is supposed to cushion the impact, and therefore they have to buy a helmet that has the element of cushioning the impact. So talking a little bit about whenever you do any campaign, you have to think about how to evaluate it, how to make sure that actually it worked. So to ensure that the campaign was able to achieve its goal, an evaluation plan should be put in place. It could be a survey that you can do a survey before and after. So you do a survey of motorcycle users before the intervention and after the intervention. You ask them, do you use a helmet, yes or no? في شيء اسمه indirect measures could be used to assess For instance, the quantity of soaps used in school before and after the introduction of intervention. So here, in class, I talked a little bit about the difference between direct and indirect measures. A direct measure is whenever you measure directly the outcome of interest. So if I install a camera and I look at people passing in an area on motorcycles and I observe how many are wearing helmets and how many are not, this is the direct measure. Versus if I send on WhatsApp a survey asking people, do you have a motorcycle? And when you're on your motorcycle, do you wear your helmet or not? That will be considered an indirect measure because you're not sure if they're answering correctly. Also, an indirect measure, you could look at the sales of helmets before your campaign and after your campaign. Um, Here you have a good example for soaps. مثلا, after we have increased the knowledge that it's important to wash your hands with soap, at LAU we can look at قديش كان في عنا consumption soap before the campaign and after the campaign. Whereas a direct measure would be to be directly observing people washing their hands using soap. All right, so that was the individual level. Now we're going to the community level. Remember, this is health promotion intervention. So it's an intervention that is going to not target individual. It's going to target the community. So creating an environment that enables individuals to be healthy. You're not changing people, you're changing their environment. Rationale based on the assumption that the immediate environment can enable or inhibit person's ability to engage in healthy behavior. The immediate environment contains factors that promote health, like walking trails, or factors that are detrimental to health, for example, pollution. So the targets of a community level are typically the infrastructures, the policy, and the laws. So infrastructure, as we said, you can make place for people to go and walk. You didn't change people, you changed the environment, but now people can go and walk. You can provide recycling bins, and people will start using recycling. You can do policies and laws. So policies and laws are kind of the same thing, but it depends on which level you're working with. So you create a law where you cannot be on a motorcycle unless you are wearing a helmet. You're not allowed to go in a certain closed area unless you're vaccinated, things like that. The most obvious infrastructure determinants of health targeted by health promotion intervention at the community level in water supply, the sanitation, the food supply, the physical environment, and availability and accessibility to schools and primary health care. في كمان an important role for health education is important at the community level. For instance, the community leaders should have basic awareness of the health issues and information before they undertake infrastructure development or bypass law. Think about waste management in Lebanon. What is the best way to do that? Is it incineration or landfilling? While people making the decision, they should have a good understanding and a good education about the topic. Building dams for water in Lebanon, uh, is there been studies that can support or not support building these dams in specific places? Would building dams have any determinant effect on the environment or not? التوتر العالي for electricity passing through residential areas. Is there studies showing that they should be at a certain height versus not a certain height؟ لأنه ساعتها القوانين that they will make the, those that create the laws uh, لما بيحطوا the guidelines of making هول التوتر العالي, so they would make sure that it's passing a certain distance, etc. Evaluation, again, assess the proportion of the community that lives in safe environment, has access to safe water and sanitation, and easy access to healthy goods and not exposed to pollutants. You can be assessing مثلا تجمع بلديات منطقة معينة. They decided that ممنوع يكون في موتور كهرباء without a filter. So an evaluation would be how many of these motor generators have installed a filter, for example. A higher up level is the state and national level. كمان we're still with health promotion intervention. The goal is resource allocation or laws or regulations that enable local governments to modify infrastructure or require the government to provide health promoting services. The rationale, the assumption is that allocating funds can enable communities to develop infrastructure that promotes health. Proposing laws or regulation can enable communities to deter individuals or groups from acting in ways that are detrimental to health. The target is typically local government or local organization, community coalitions, or community health centers involved in promoting health. The intervention are typically providing funds for health promotion through grants program. Obviously, this is very typical of the US. I think this whole thing is very typical of the US. Grants require the applicant to describe what exactly they intend to do. And number four is evaluation. Number of communities that did not have a certain service, and then they were able to develop the service. Global intervention treaties, agreements among nations related to safety of products. And here you have an example: children's toys, design, the size, etc. They're all under the some agreements at the global level. US makes agreement with trading partners to assure that the food product important are safe for consumption. The last part of the lecture is again the role of health promotion activities in community pharmacies, and I will leave it for you to read it on your own. So that concludes this lecture on health promotion.